Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We're one
therapist.
of the most famous physical therapists on the internet.
In our opinion, of course,
Kind of like
Bob.
superheroes.
Yeah.
Yeah. Today we're going to talk about immediate relief and self-treatment of the sacroiliac joint, or the SI joint,
Sure.
as it's referred to. We're going to show you where it is, and we're going to show you some things to try, because we're not going to have you try to diagnose what you have specifically going on with it, because it's too difficult for you to do that. But we can show you things to try, and if it takes away your pain, hey, c'est la vie, c'est la vie.
And these treatments, they're going to, when they work right now, and you're going to feel that pain come down. If they don't, they don't, or sometimes they irritate a little bit, then you're going to stop those. We'll clarify that. And so make sure you wait for that. But Bob has something to mention to everyone.
Yeah, in case you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, Brad's going to do his job here. Go over to the Facebooks and like us, because Brad and I, as children, it's sad. You're tearing up a little bit. We're not liked, and now we're trying to turn things around. So you go to Bob and Brad.
There you go, Bob and Brad. And now SI information. Sacroiliac, Bob, that's a big term, and it really, I think, is kind of throws people off, because
I've heard some people think that their back pain is sacroiliac just because it sounds like, well, I'm having sacroiliac pain.
Right.
It's really their back. But it is often in that same region.
Sure.
So that's why people, it could be.
Should we use Sam?
Sure.
Sam to help? So the SI joint, sacroiliac, the word comes from, here's the sacrum and here's the ilium.
The sacrum is a triangle-shaped bone.
Big solid one there right at your
These
buttocks.
are the two pelvises kind of on each side of it.
Yep.
So that's the ilium.
You're right. And so the joint is right here. It's where the two bones connect. It's not a joint that moves very much at all. And that's controversial in the medical field. We're not going to get into that.
There's a lot of big, heavy ligaments that are holding it in place.
Right.
So if you see an anatomical picture of it, you'd see why it doesn't move much.
Right.
But we think there is some movement.
Sure. Okay, so that's the SI joint. Now, this is going to be something new for Liz.
Liz.
Can you zoom in right in here? So here, if you can see, Bob, can you hold the sacrum?
Sometimes, Liz, we have to be at a certain distance from you. Does this work out okay?
We're going to ignore the nerves and get that out of the way. So here's the sacrum, and here is the ilium. Now the joint, now this is what can happen. There can be slight movement in there, and actually...
I would actually show that from the side too, Brad.
Good idea.
How this can, see how that rotates?
Yep.
So it can be rotated back.
That's
and kind of stuck that way, or rotated forward and kind of stuck that way. So we're going to try getting some movement in there to see if that relieves your pain.
Right. So that's what these exercises are going to do specifically. And if you get it to move the right direction, the pain's going to drop right down. You're going to feel it. So
I think the other thing we should mention while we're here, Brad, is what are some of the causes of this?
Real good point.
Yeah.
It's like if you're walking and you...
We'll back up again.
Inadvertently step off of a curb and you come down real hard and it puts a jolt through that. That can take that joint and rotate it.
So if you, as a matter of habit, are always sitting, like let's say you sit with even your legs crossed and you're always putting weight on one side, you know, year after year after year, you're actually putting stress on the, you know, the ilium's in a different way, and it can actually cause a little bit of rotation.
Sure. If you're a car accident and you get your knee goes into the dashboard, if you had that kind of force into that can shift the SI joint.
If you have one leg longer than the other.
There you go.
That can actually, I see that quite often in people that are that have, you know, especially if it's like more than a ½ inch.
Sure.
I mean, it can really make a difference.
Or you get a total knee and maybe they didn't quite get them right, and all of a sudden you have a sudden change. You got a shorter leg after surgery.
And one of the more common ones, which Liz, our camerawoman, can attest to, is when you're pregnant. I mean, there's those chemicals that help loosen up the ligaments, right? And it makes them easier to rotate and cause you problems.
Chemicals.
No, body chemicals.
What do they call hormones?
Yeah. Well,
just you know,
they're a chemical, aren't they?
I would imagine, yeah. It just sounds better to be.
Okay. Hormones.
Now, let's say, as a matter of fact, this just happened to me 2 weeks ago in the clinic, and it worked so well. It's like, man, we got to get this out to our viewers.
Sure.
She had back pain. Typically, if it's SI, it's when you walk or put weight through it is when it's worse.
Yeah.
When you sit down, typically feels better.
better,
Or
right.
laying down. So this
Hills
person,
are worse, stairs are worse.
right, that weight bearing, putting force, making that SI get pushed and painful. Pain is typically here. It can go down the leg, usually not below the knee.
I have seen it referring to the groin too, Brad.
Sure, wrap around there.
Right, yep.
Yep.
So,
So with that in mind, this is what you're going to do. If your symptoms sound like that
Similar
may be
to
that,
that.
you may have incident that of the causes that we mentioned. This is what your first thing you're going to do is, I wish I had a chair, Bob, here.
we're really prepared here today.
Well, it's not far away, Bob.
Okay.
If you're in a nice firm chair, you don't want to do this on a couch or some soft chair like that. Good firm chair with good posture. If you take your knee up and lift it and say this is a painful side, this is called a muscle energy technique in the therapy world. I'm going to push down and hold it and actually do an isometric. And this patient that I had just a couple weeks ago, she did this immediately. She said, boy, that feels good. I mean, it was very clear. So her home exercise program was to do this, hold it for about 5 seconds and relax.
So how often were you having to do that, Brad?
I told her to do it every 1 to 2 hours.
Sure.
You know,
and that's the thing is you don't just do it once a day. You're doing this constantly to try to help gradually adjust that so that it stays back in place and
Right.
feels better.
so, you know, she came back and it was working, but it kind of plateaued. It got about 50% better. So then the next thing you can do, and if that one doesn't work, you could go to this and you go to the side of the bed.
Don't fall off.
Yeah, don't fall off. You take the painful side and you gently let it down on the side of the bed, and then we're stretching. Technically, we're trying to get a posterior tilt into an anterior tilt with
Right.
both of these techniques. Don't worry about that. If you do this, and this is her situation, this just felt good. She just said, "Oh,
And
that
you could
feels
even,
good."
you'd probably want to lock it in place, wouldn't
Yeah,
you, Brad?
yeah.
I mean,
That's a good point.
Yeah, you want to hold on to that knee and let this one hang down.
Yeah.
And that's going to help, again, adjust that SI.
Right.
It's something you try and see if it feels better.
And if it doesn't, if it hurts,
You don't
you
do
just
it.
scratch it.
Especially if it makes it worse.
Right. We've got 2 other ones that you're going to try. If both of those don't give you that immediate relief, then you're going to go to this one. Actually, you can stay laying in the bed.
To me, sometimes, Brad, is that if this actually makes it worse, I'm sometimes happy about that because that means maybe if I go to the other side, it's going to make it better.
Precisely. Yep. So this, I'm still on the same leg. That's a painful side. Those 2 techniques didn't work. I'm going to take this knee, bring it up to my shoulder, and then I'm going to hold it, and I'm going to take my knee and push it that direction while I hold it. So we're actually doing an isometric, another muscle energy technique. Hold and push, and if that feels like good pressure, feels good. And I've got an SI problem on my right side, and that's feeling good right now. And I
Just
do.
getting that out of the way.
I do these 2 on myself on a regular basis. I actually like to go around like this because you're a little more stable and then push like that. But it doesn't matter, whatever makes you feel better. You can take this leg and put it down or here,
Or
whichever,
up, sure.
whichever works better, gives you better results. And again, you're going to hold it 3 to 5 seconds.
So again, if he wasn't holding it, that knee would come right down.
Right. Yep.
Yeah.
So I'm going to do that 3 times, and then you're going to repeat that throughout the day, again, once every 1 to 2 hours until you reach a plateau with your progress, and hopefully it'll be gone. There is one other one that's similar to that.
Is that the stool one, Brad?
Yeah. You can do this on steps because it's
Oh, sure.
different
Yeah.
heights, and if you got a rail
And
to
you
grab
got the
onto.
rails helps you even do it
Yeah.
even better.
This is a little high for me, but it gives you the right idea. So you're going to go up there, and if you do it on a stairwell, you're going to hold onto the rail, and then you just lean into it. And once again, it should feel like, oh, this is a good stretch. It's making that pain feel better. And then when you're done, you walk around. It also should feel better. Then you know you're right on. So there you got 4 different options for SI joint pain that are going to immediately cause relief if it's the right one. So
And then you can also try, basically, if you want to try a belt, an SI belt,
oh, sure.
you could give
You
that
bet.
a go.
Just happen
And-
to have one, Bob.
Yeah, and basically what you're trying to do is you're trying to hold the pelvis together And this is, again, in those cases where the hormones are taking place, and if you're pregnant. Now, Liz, she's had a couple children, and she has one that she has to watch in addition to that. And Alex, I always like that joke.
Yeah, that's her husband, by the way.
But she tried it, and you had good success with it, right, Liz? But, you didn't have this one, but she had one that was made for a pregnant woman.
Right. So it puts force around here and stabilizes those joints.
So the way I determine whether or not it might help someone is I actually go up to the person, no, Brad, and I actually push on their pelvis, and I have them walk. And I know this is kind of a goofy thing to do, but you walk behind someone, and if that gives them a relief, then there's a good shot that the belt's going to help.
All right, so you get one of these SI belts, and you put it on here, and it has to be on the pelvis, not too high in the waistline.
Yeah, the pelvis is right here. It starts right here, so it's below the pelvis.
Yep, and you can tighten it up from both sides. You get it nice and snug. Should feel good, and then you wear it throughout the day.
And a lot of times, once you get it calmed down, it stays calmed down.
Right.
That's the whole idea. When things get inflamed, it can be very difficult to get that inflammation to come down. So that's why this can help with that. So
a lot of different options. And once again, Bob, I really like to tell everyone here, we can fix just about anything throughout the body except for
a broken heart.
There you go. But we're working on it.
And we can give you advice, too, on, if you're lovelorn and you're having trouble finding a
Well,
date.
we could. It might not be good advice.
No, it's not good advice, but we can give advice. So thanks for watching.